Welcome to the Explainer. Today, we're breaking down a core nursing skill that you're definitely going to use: nasopharyngeal and nasotracheal suctioning. It sounds complex, but trust me, we're going to make it simple.
So here's our game plan. We'll start with the why, get into all the prep work, walk through the actual procedure, cover what to do when things get tricky, and then tie it all together so you can really master this skill.
Okay, let's dive right in. Before we even touch any equipment, let's talk about the most important question. Why are we even doing this? Understanding the core reason behind it is what separates a good nurse from a great one. So picture this scene. It's super common. Your patient just can't get those secretions out. This is exactly where you become so important. This is where nasal suctioning becomes an absolutely essential intervention.
Now, it's super important to know the difference here. Think of it like this. Nasopharyngeal suctioning is basically clearing the upper airway, the pharynx. But nasotracheal suctioning, well, that's when you gotta go deeper, all the way into the trachea. It's all about how deep that catheter needs to go.
All right, now that we get the why, let's move on. Proper preparation is, and I can't stress this enough, non-negotiable. It's all about patient safety.
Before you even grab your supplies, these 4 safety checks are your absolute first priority. Seriously, confirm the patient, check for allergies, make sure there are no contraindications like facial trauma, and know when they last ate to cut down on that aspiration risk.
You know the saying, measure twice, cut once. Well, in nursing, it's gather everything first. Having it all ready at the bedside is going to prevent so many headaches and keeps everything sterile.
And here it is, the standard equipment you're going to need to have ready to go before you even think about starting the procedure.
Okay, pay close attention to this number. This is the suction pressure setting for your adult patients. Getting this right is absolutely crucial.
And notice this. See how different it is? For pediatric patients, the pressure is way lower. This is a huge safety point to prevent causing any tissue trauma.
Okay, prep is done. You're all set. Let's walk through the procedure itself step by step.
These first steps, they're the foundation. They're all about patient comfort, reducing anxiety, and of course, preventing infection. You'll do these for both types of nasal suctioning.
This right here is the golden rule. Let me say it again. You only, and I mean only, apply suction when you are withdrawing the catheter. This is so important for minimizing damage and hypoxia.
So this slide really gets to the heart of it. You can see the key actions here: lubricate, insert, advance to the right spot, and then and only then apply that intermittent suction as you pull it out.
And remember this, each time you go into suction, from the moment you insert to the moment you're all the way out, it should take no more than 10 to 15 seconds, not a second longer.
So you're done suctioning, but wait, you're not actually done. Your job continues with assessment, troubleshooting, and, of course, documentation.
Think of this chart as your cheat sheet for when things don't go perfectly. If you hit resistance, don't force it. If the patient's stats drop, stop right away and give them oxygen. It's all about knowing what to do and staying calm.
And you know what they say, if you didn't chart it, it didn't happen. Accurate and quick documentation is so important. These are the key details you've got to record in the patient's chart.
Whew, we've covered a lot of ground. So let's just boil it all down to the most critical points that are going to help you really master this skill.
Okay, if you remember nothing else from this explainer, remember these things. These are the absolute core principles for doing this safely and effectively. No cutting corners on these.
We really hope this breakdown helped clarify the whole procedure for you. It can seem like a lot, but you got this. And hey, if this was helpful, do us a huge favor. Like, share, and definitely subscribe to our channel so you don't miss our next Nursing Explainer video.
Also, for all of you studying for your exams, you got to check out the links in the description. We have some awesome summarized NCLEX revision books for all your nursing courses.
And last thing, we really want to help you learn what matters most. So tell us, what's a critical nursing skill you'd like us to break down next? Let us know in the comments. We'd love to hear from you.